Preventing infection is extremely important with joint replacement surgery because once the metal parts are placed inside your body, we cannot take them out again without causing significant damage.
A famous person once said, "An ounce of prevention is worth a pound of cure." This couldn't be more true when it comes to preventing infection with joint replacement surgery. Preventing infection involves several different things. These include decreasing the number of bacteria on your skin and inside your body, helping your immune system be in better condition to fight off infection, and using antibiotics and clean surgical techniques during your surgery, and preventing contact of your incision with bacteria after surgery. Many people think that a surgical infection is something that you can get from a hospital. That's not exactly true. Most of the bacteria that causes joint replacement infections are growing on our patient's skin. It is much less common for bacteria to come from the hospital or from members of the surgery team. Bacteria can get into your body when your skin is opened. Probably the most important thing to do before your surgery is to clean your skin. It's important to take showers daily during the week ahead of surgery. We will be sending a special soap called chlorhexidine home with you to help you clean your skin the day before and the morning of your surgery. The next most important thing is to keep your skin protected from damage. If you've had any breaks in your skin in the area where we prepare or clean your skin for surgery, it's not safe to proceed with the surgery. Every month we have patients whose surgeries have to be canceled because of cuts, scrapes, or scratches on their legs. This can be very disappointing when you've made personal and family plans around your surgery day. We would like to help keep every one of our patients from experiencing this disappointment. The best way to make this happen is avoiding the things that put you at risk for skin damage. Our favorite pets with claws can cause damage to our skin. The lawn may need mowing, or you may decide that you want to go out for a hike before having surgery. You may have a condition that causes dry or itching skin and may contribute to your feeling like you have to scratch in order to get pain relief. Please keep your legs covered with pants that are thick enough to resist punctures and cuts if any of these conditions apply to you. You may have a skin condition that makes your skin prone to developing raised plaques or scabs. Psoriasis is a common skin condition that forms over our knees and elbows. If you have psoriasis or a similar skin condition, it's important that you see a dermatologist and have this treated fully before proceeding for a joint replacement surgery to minimize your risk of infection. If you notice any concerns with your skin during 2 to 3 weeks ahead of your surgery, please call your surgeon's office for advice on how to proceed. If you have damage to your teeth or gums that need to be treated within the coming year, this should be taken care of before surgery. Increased blood flow around your hip, which will be present for a year or more, makes your joint replacement at a higher risk of infection during the first year after surgery. If you have frequent bladder infections, it's important that this be evaluated and treated before your surgery. Most of the time, a bladder infection can be treated with a short course of antibiotics for 5 to 7 days ahead of surgery. Your body needs to be working at its best to help fight infection. It's important to manage weight, keep blood sugar levels under control, to make sure that you have a good amount of protein in your diet, and to avoid tobacco products when you have surgery. Your surgeon may recommend delaying surgery until these things have been controlled. We will give you antibiotics to help prevent infection from the majority of bacteria that grow on our skin. During your surgery, all members of the operating team wear exhaust suits using sterile instrumentation and strictly pay attention to sterile techniques. We also limit the movement of people in and out of the operating room during your surgery. We like for our patients to build up strength in the muscles surrounding your joint before having surgery. We encourage patients to participate in Prehab, a preoperative rehabilitation program in the weeks or months before surgery. Our patients who have participated in a Prehab program do much better than patients who have not. Better strength and joint movement before surgery improves pain, mobility, and time to going home.